Welcome everyone to Diabetes Canada's 2017 webinar series on diabetes complications. My name is Farah Ismail and I will be your host for today. We are delighted that you're able to join us today for the webinar to learn about mental health and mindfulness. Now to start off, I would like to draw your attention to our survey. It's located at the top right-hand section of your screen. In order for us to better serve your needs, we kindly ask that you provide us with your input by completing the short survey towards the end of the presentation. And we thank you in advance for your input. Now, throughout today's presentation, you will have the opportunity to ask questions, and this can be done by simply typing your questions in the question and answer box, which is located to the bottom right-hand section of your screen. Our presenter will be happy to answer these at the end of today's presentation. Also note that you are able to customize your screens. You can expand and collapse them as you see fit, so feel free to do so by adjusting the bottom right-hand corner of each of our webinar pods. Our presentation today will last about 35 to 45 minutes in length, and we'll have about 10 minutes at the end for questions. Would also like to note that today's presentation is recorded and will be made available on our Diabetes Canada website in the coming weeks. Our webinar today on mental health and mindfulness has been proudly supported by Eli Lilly Canada. Now I'd like to welcome our speaker, Dr. Jackie Gardner-Nix, and thank her for joining us today. But before turning it over to her, I'd like to give you a brief introduction. Dr. Gardner-Nix is a chronic pain consulting physician, Department of Anesthesia Pain Clinic, St. Michael's Hospital, and an associate professor in the Department of Anesthesia, University of Toronto. She is also on staff at Northumberland Hills Hospital, Coburg. She trained in the renowned John Kabat-Zinn's mindfulness-based stress reduction program in the USA in 2001. From 2002, Dr. Gardner-Nix evolved the mindfulness-based chronic pain management program from the MBSR program, customizing it to the needs of chronic pain sufferers. In 2010, she established the NeuroNova Center for Mindfulness-Based Chronic Pain Management, renamed NeuroNova Center for Mindful Solutions in 2016, to reflect a broader mandate, which includes delivering courses to staff of corporations for stress. NNC creates and publishes materials for the MBCPM courses and trains, accredits new facilitators. Currently, the MBCPM courses are being delivered by a growing number of other healthcare professionals across Ontario, and as well in the USA and Australia. Her work has been reported on CTV News in April of 2013 and CBC News in December of 2012. For more information on Dr. Gardner-Nix, please read the speaker bio section, which is located to the left of your screen. So without further ado, I present to you Dr. Jackie Gardner-Nix.
So it's a great pleasure to be running this webinar today and sharing with you some insights that I've gained through being a chronic pain consultant in pain clinics in the teaching hospitals in Toronto, and really understanding a lot about the mind-body connection as it applies to many, many health conditions, not just those that cause pain, but health conditions such as Crohn's disease, diabetes, all the conditions we tend to see in the clinics. So we're going to start with a slide which talks about neuroplasticity. And we've come to really understand this as a word that means the brain can actually change. There are some best-selling books out there about this at the present time. Norman Deutsch, for example, who has written the book, The Brain That Changes Itself. But the brain indeed can change in ways we used to think it could not, depending on what we ask it to do. So I'm going to give you this to think about. What do London, UK taxi drivers have in common that is about neuroplasticity? Jugglers, cyclists, piano players, and readers in Braille. Can you think for a moment about what they have in common? That's to do with the brain changing itself. I'll give you a moment or two, and maybe you can jot it down. And the truth is that brain pathways that are learning are actually causing neurons which fire together to wire together. You're actually changing brain density in those areas so that UK taxi drivers who have to know their ways around London very, very well, they have to know the streets of London. It takes them 2 years to learn it, so it's quick for them to find ways, paths, to get their clients to where they need to be. They actually show evidence of increased brain density in an area of the brain called the hippocampus, which is for direction finding. And once they stop doing that work, after a few years, those pathways actually start to disintegrate. So now perhaps you can see how cyclists would have to generate pathways that show their legs how to cycle, their minds how to create a balance for them so they cycle with safety. Piano players, anyone that's playing a musical instrument and becomes better and better at it, are actually increasing the density of their brain pathways as the neurons that are learning start to fire together. And then it becomes automatic. But the interesting thing is that we are utilizing these very pathways in order to promote habits all the time. As Aristotle noted, we are what we repeatedly do. Excellence then is not an act, but a habit. You may have heard that somebody who's an expert, somebody who plays music, for example, has often done 10,000 plus hours in rehearsal in order to become as good as they can be. And that is actually generating these brain pathways. So the question, how can we use our minds to alter our behaviors and our bodily reactivity to perceived stressful events and challenges, and as a consequence, improve the state of our health? And I hope to show you that as we discuss the mindfulness practice. But first, we're going to discuss what stress does to us. Okay, I'm going to stop there. So taking a look at pain as one of the examples of a health condition that I've been treating, it's interesting to note that pain, illness, and dysfunctions are actually experiences. Pain is not just a sensation. Everything we experience is an involvement of the body and the mind. And the mind is hugely influential in healing and pain perception. But unfortunately, along the way, it can become too reactive and turn against us. So we do have to be thinking as physicians, as healers, as the healthcare community, we're always having to think about the mind-body connection when we're working with managing health conditions. Some of the researchers that have been looking at this are actually showing with brain imaging, such as functional MRI techniques, that emotional areas of the brain, as well as those detecting physical sensation, are involved in chronic, long-term, painful illnesses, with distributions throughout the brain that become characteristic of the condition, such as back pain, pelvic pain, arthritis. And I've noted here, it's Apkarian's group in the States that have done a lot of work on this issue. In other words, if you have a chronic low back pain condition, after a few years, researchers can actually look with a functional MRI of your brain. That's not the usual diagnostic one, but it's one which shows what areas of the brain are actually active at the time they look. And they can show that there are areas in your brain, in the anxiety areas, the worry areas, that light up when your back pain is being perceived and can actually make it worse. They have a feedback effect on not allowing the pain to dull down with the usual mechanisms that we use from the brain, top down, to dull the areas that are painful. They interfere with them, the more emotionality that we have. And this can be very subconscious. So it can be way beyond your obvious perception that you are actually thinking on a subconscious level about how it's holding you back, how it's stopped your ability to hold down a job, how it's interfering with your family life, and all that lights up the instant that the perception of an increase in pain is observed. However, the good thing is that with good pain management, including medication if you need it and if it's helpful, including mindfulness work or cognitive behavioral work, can actually reverse that automatic emotionality that can occur when pain is perceived. Interplay of mind with pain. Quite fascinatingly, I found that in clinic, what I'd observed in patients, this is many years ago and continued to play out as time went by, was that falling passionately in love reduced medication use. And we actually know that passionate love looks like heroin in the brain, but it was consistent in reducing medication use if somebody was in that 2 years of the phase of passionately being in love with somebody. And that changing from a toxic relationship to a newer, more pleasant one could also reduce pain medication needs quite significantly and even get people back to work. We also noticed a shorter-term thing, that going on a pleasurable vacation reduced medication use. However, pain reportedly returned to its original intensity the minute the plane landed at the home airport. All the triggers of your life kind of flooded back as you disembarked that plane. People that went to the cottage and noticed that their pain was less at the cottage and they needed to use less pain medication would report that they'd be picking up their pain again, their pain intensity, as they returned to the city, just like they were picking up their dry cleaning. And this was a consistent observation that we were noticing, albeit on an anecdotal level. So you might want to be thinking about that. It's a very fascinating phenomenon, but it's all to do with the triggers that occur in our everyday life, which actually influence pain we perceive, also influencing likely your blood sugars. So blood sugar may be much easier to control when you're in a situation where your triggers are in the background. They're not there for you as much. And your environment will actually dictate that. Yet think about it. Your MRI findings still stay the same if you're thinking that it's all to do with the degenerative changes in your low back or in other areas of your body, such as in arthritic conditions. Know that stress is intimately involved in our ability to heal. Caregivers of Alzheimer's patients who are considered to be a stressed segment of the population, small wounds take an average of 9 days longer to heal in those people than in controls. Stressed people exposed to colds and flu have more severe symptoms. Healing after back surgery has been shown to be affected by past history of childhood adversity. It plays in. Yet, MRI, CT scans analyzed by radiologists to predict pain show no correlation. It's very fascinating that there is correlation. So this was a research study that really showed that degenerative changes that you see don't necessarily predict whether you have pain or not. In fact, if you look at this, you might be quite surprised. Degenerative changes in our bodies are the norm as we age. We really start generating degenerative changes quite early in life. Lumbar disc degeneration is present in 90% of people 50 to 55, and yet there's no pain in many of them. In the neck, 98% of all men and women have degenerative changes, and yet with no neck pain. And in shoulders, MRIs show that 20% of adults with no pain have partial rotator cuff tears. 15% have full tears. When 60 and over, 50% of us have torn rotator cuffs with no pain. Looking at knees, arthritis is visible in 85% of adults on X-ray, but with no pain. So why is it that we do have pain in some adults, and yet others don't, even with similar changes on X-rays and MRIs? We know that stress and your past history have an effect on what you notice now in terms of illness, in terms of pain, in terms of whether you can manage your blood sugars and so on. Being highly reactive to stressors, even subconsciously, even without really noticing it, is a key factor affecting pain and healing, inhibiting immune system dysfunction, predisposing to illness, poor repair, and poor vigilance of the body. And it includes physical stressors such as poor nutrition, poor exercise or poor attempting at exercise, and poor sleeping. And for some people, we've noticed, or we've heard back from some people, that they feel hypervigilant at all times. They don't know what it's like not to feel stressed. Now, I also want to point out, though, that our bodies seem to have a mind of their own, and that's probably training, subconscious training, from the time even before birth, from time that we're born on through childhood. Such that, for example, if you're going through a major life stressor, such as moving house, such as going through a divorce, such as bereaving a death in the family, however resilient you feel your mind may be, your body still has a way of telling you about it. It still has a way of requiring us to consider it and to look after it more carefully at the times of high stress. This is not something we can cognitively have influence on all the time. So very, very important to take those times and be more careful at self-care. Let's just think for a moment about mind-body connection. And we often use this as an example in our courses of the body having a mind of its own. You have two items to buy. You're in the 1 to 8 aisle to go through the checkout. This is a North American situation that many of us are familiar with. Yet your back pain is acting up that day and you'd really like to get home quickly. But this is what's in front of you. A person with a full buggy, and the checkout person is checking them out. What is likely to happen to your pain as you stand behind this person? Or if you aren't a pain sufferer but you have diabetes, what is likely to happen to your blood sugar? Think for a moment about what you think may happen. The usual answer is that pain is going to start to get worse. Maybe your blood sugar is going to start to rise because of the stress of the situation. More than 75% of the population will hold this in. They won't say anything, they'll just fume. And they'll start to do some self-talk about what the person in front of them is thinking. Like, they must know that I'm in pain behind them. How dare they do this and not go to the correct checkout? Don't they know I have to get home quickly? And what's going on with the checkout person that they are calmly checking this person out? By the time a chronic pain sufferer gets out to the parking lot, their pain can be sky high. And for chronic pain sufferers, unfortunately, their pain can persist for hours to days afterwards. For somebody who just experiences transient pain, likely it will go back to baseline within a short while. But for somebody with chronic pain, this may be the start of several days of increased pain. So stress is not good for us. Research has even shown that adverse emotions such as chronic anger is associated with increased pain levels and increased requirements such as of opioids that might be being used to manage chronic pain. Lack of forgiveness is associated with low back pain as well. There are various conditions or various emotions which are associated with a higher chance of having certain pain conditions. Fibromyalgia, horrible condition that affects women more than men, and usually women as they are getting older, and usually highly sensitive individuals. So we've sort of noted that people with fibromyalgia do tend to be more highly reactive than usual, highly sensitive individuals, often people pleasers. And This has even been thought to be associated with increased stress during their mother's gestation when they were in the womb. And they have different cortisol levels. So there's a whole research body around fibromyalgia right now, finding correlations between their past histories that go way back and their predisposition to suffer from these painful conditions. And we've known for a long time that hostility, chronic hostility, is a major risk factor for heart disease, independent of blood pressure conditions, of obesity, of other predisposing factors that can cause heart disease. So emotions are definitely on the map in terms of predisposition to all sorts of health conditions, autoimmune conditions too. Many adults that suffer autoimmune conditions have associated prior childhood stressors. I may mention that again in a future slide. Now, looking at diabetes, human studies on the role of stress in the onset and course of type 2 diabetes are few, but a large body of animal studies supports the notion that stress reliably produces hyperglycemia in this form of the disease. And I think that's pretty common knowledge to all of us, all of those who suffer it and all of those who manage it. Type 1 diabetes, which is more of an autoimmune condition, we also know there's a two-way street going on here, that anxiety systems are associated with less frequent BGM, which is blood glucose monitoring, and poor blood sugar control in adolescents with type 1 diabetes. And up to 20% of adolescents with type 1 diabetes experience elevated levels of depressed symptoms, a rate 2 to 3 times that found in the general adolescent population. Again, a two-way street. Is it the blood sugar being up, or is it that depression predisposes them to checking blood sugar less and making poor choices with what they eat and how they exercise and so on? Depressive symptoms have been linked to poorer disease management and glycemic control in adolescents with type 1 diabetes. The mind-body connection. Interestingly, too, we know that job stress is huge, especially, I would say, in the North American population. Numerous studies show job stress is far and away a major source of stress for American adults, and that it's escalated progressively over the past few decades. Increased levels of job stress, as assessed by the perception of having little control but lots of demands, have been demonstrated to be associated with increased rates of heart attack, hypertension, and other disorders. And showing you the next slide. In New York, Los Angeles, and other municipalities, the relationship between job stress and heart attacks is so well acknowledged that any police officer who suffers a coronary event on or off the job is assumed to have a work-related injury and is compensated accordingly, including heart attacks sustained while fishing, on vacation, or gambling in Las Vegas. But they will actually be allowed to go on workers' compensation simply because they know that job stress increases overall the likelihood of such events as heart attacks and strokes. Let's look at main causes of stress. Well, 20% is associated with juggling work and personal life needs. 6% lack of job security, and that's getting worse out there. 48%, I think it is, if I can read that, is associated with workload. So more and more as people are being let go and jobs increase in their requirements, people are noticing workload is associated with stress symptoms. And then there are people issues. 28% is associated with people issues, often to do with perhaps family members or to do with colleagues at work, bosses, and so on. And again, what we're looking at with mindfulness work is being able to change that resilience level, as you will see shortly. Childhood adversity, so what's happened to you in your past, actually affects your current disease resilience, your current ability to function well in your families, in your workforce, to reduce the amount of illness you might experience. So adverse childhood experiences have been investigated in huge studies called the ACE studies, and they've looked at 8 adversities in childhood, such as abuse, sexual abuse, loss of a parent, divorce, and so on. And the ultimate 18 health outcomes, so they've chosen 18 health outcomes looking forward into adult life and seeing if there's a correlation between what you've experienced and what you might actually get in your adult life as a health outcome. And they've showed that past experience definitely has an influence on what you're likely to suffer from later on in life. This is an interesting and well-known study, and it really shows the connection between past life experiences and future health outcomes. And I call it the exposome. I've lifted this from an article I saw and some research I saw on exposomes, the totality of health-affecting exposures, what you've come through in life, which may be the pregnancy you had in your mother's womb, the childhood you had growing up, the role modeling from influential people, including your parents, and also exposures such as adversities. It could be refugee status, it could be bullying at school, it could be losing your home at an early age, but we can connect early life exposures with later health problems. And so it's really important for parents to understand this and provide as good a support as they can to their growing children. Teachers to know it as well. Governments to know it when they're helping with refugees, with people coming into our countries, with adversity of children in our countries that were born here but maybe are dealing with addictions in their parents, criminal behaviors in their parents, and so on. It's very important that we know that as children grow and experience all sorts of adversities, we need to give them good role modeling, good support, and help with resilience for later life exposures. Tics is definitely involved, no question, and there's research on that, so certain genetics will confer a benefit in many areas. But whereas genetics loads the gun, the environment, how you are watching your role models, what supports you are given, pulls the trigger or not. And this has been really well shown in things like the development of diabetes and so on. Just giving you an idea, celiac disease, which is gluten sensitivity, isn't uniformly expressed in identical twins. And it's been shown that as there's only 2/3 coherence, meaning that 2/3 of identical twins will both manifest celiac disease, which is an autoimmune disorder, and 1/3 won't. The interesting thing is what happens to the 1/3 where only one twin experiences celiac disease and the other is free of it, what has happened in their life exposures. Because from the time they are in gestation and right through birth, identical twins are exposed to different experiences, even slightly different experiences, and it helps to change the genetic expression that they grow up with. So, can we have control over stress? Can we create greater resilience? Can we help our bodies to become more resilient, even though it sometimes seems that our bodies have a mind of their own? And the answer is we probably can. The use of the mind, the power of the mind. For example, this headline which suggests that the mind can be harnessed to beat chronic pain. This Time edition was entirely devoted to the mindful revolution, and more recently, Time magazine has been on the stands speaking about mindfulness in many, many areas, such as in healthcare, in schools, in prisons, and so on. And there are various mindfulness-based therapies. Mindfulness-based stress reduction was one of the first ones to be introduced in the 1980s by John Kabat-Zinn in the States, and has now spread throughout the world as a course which increases resilience and decreases our reactivity to stress. Mindfulness-based cognitive therapy, which really intervenes for depression and prevents relapse. And then we modified mindfulness-based stress reduction to be mindfulness-based chronic pain management or mindfulness-based chronic stress management for the clinical population, and really made it a trauma-informed course that actually helps people to manage their realization of past traumas and to go forward with improved reactivities and resilience. Well, it sounds extremely simple. It's moment to moment, but the important thing is non-judgmental awareness, being fully present with what is happening right now. And we are rarely present with what is happening right now. Our minds are usually engaged in thinking about future events or thinking about past events, but very rarely are we in the now. And even more rarely are we in the now in a non-judgmental way. Up until we learn about mindfulness, our thoughts in any one moment are usually influenced greatly by our prejudices and biases that have been entrenched in us from all our past experiences. And so anything we perceive is highly colored by our judgments. And if we're extremely judgmental people, and some highly sensitive people tend to be that way, we are constantly suffusing our body with stress hormones. And those aren't very good for us. Stress hormones are quite bad for our blood sugars, for example, and our blood sugars, if they're high, are injuring our organs. So to be highly judgmental people, to be highly reactive people, is not great. And training in mindfulness really helps us to tone that down a great deal and become far less judgmental and far more open and therefore less stressed. This, for example, is unmindful showering. We're not in the moment, we're under the shower, we're thinking of just about everything while we're showering, but we're not thinking about just being under the shower and experiencing the warm water, maybe the pleasure of the water on our heads or on our skins. We're not just present with those moments. And that's one of the exercises we get people to do when they come through our courses. And they are surprised at how differently they then go on to do many tasks such as showering once they're aware of mindfulness. Mindful eating, just being with the taste, just being with what we've chosen to eat, is very, very different to the sort of eating that we commonly do when we are thinking of just about everything other than what we put in our mouths. It leads to eating stuff too fast, not tasting it, not enjoying the taste of it, and often not making great choices. And again, that is something that comes into our coursework. It's very simple and extremely influential in building health into us, because we really are what we eat, and we don't often make healthy choices, especially if we're rushed. Noticing ways of de-stressing is fascinating, because actually you can be in a macro environment that can be ghastly. And what I mean by that is maybe the lady in the top picture in this slide, where she's giving a presentation, is actually in the middle of a nasty divorce. We don't know. Or maybe one of her elderly parents is on the decline and will die eventually, and she's the caregiver. But if trained in mindfulness, this lady might be giving her presentation entirely in that moment, her micro environment, which is where she's proudly using her skills to present to others, may in fact be right in the now, not thinking of the past, not thinking of the future, but actually enjoying or experiencing this moment and this skill that she's passing on. And the bottom picture, which shows somebody teeing off on a golf course, again, they may have some pretty strong things going on in their personal lives at that moment. But right now, they're thinking of just that ball and just that time, just those moments. So it's possible to actually cultivate noticing micro-environments within your macro-environments. Meditation is a formal form of this. It's focused, alert, non-judgmental, present moment awareness that we practice and actively practice and choose to practice for maybe 10, 15, 20, 30 minutes a day, where we actually stop what we're doing. I tend to do mine first thing in the morning, and I actually bring my mind into the present. And what I'm doing is noticing really just the awareness of being present, not thinking, although every now and again my mind will go off into thinking. I'll notice it and I'll bring it back. And that happens a lot during formal practice. Every meditator will tell you that. But what we're doing is getting more and more practice at being in the present without judgment. We may notice the birds singing outside. We may notice a current of air going across our bodies, but we are just aware of it. We're not thinking. We're not going off into a thought stream, although every time we do, we notice and bring ourselves back. And it's possible during that time to really exercise our parasympathetic nervous activity, which is the nerve system in our bodies that relaxes us, rather than our sympathetic nerve activity, which is the nerve system in our body that actually activates and stresses us out. So our parasympathetic is allowing time to be, brought into play, which is very important at those moments. And 20 to 30 minutes, some people do way more than that, of formal practice a day, which is what meditation is absolutely fantastic on a regular basis for changing a lot of what happens in our awareness, in our ability to manage challenges, in our calm associations with other people. It can have a ripple effect on family members and on colleagues. And Viktor Frankl, in his quote, his famous quote, between stimulus and response there's a space. Well, interestingly, when we're meditators, when something challenges us, we actually don't react as quickly. We have a few micro moments that we observe where we can decide on a wise response. That's the space that we're creating. And in that space is our power to choose our response. And in our response lies our growth and freedom. Because often the response we choose is wiser than we would have chosen in our pre-mindfulness days and keeps our body more balanced in the next few moments going forward. Can often stop pain exhalations. We encourage these attitudes in mindfulness training. They're all integral to mindfulness training. Having a beginner's mind instead of jumping to conclusions straight away. Assessing people that we meet that are maybe strange to us, different to us, but with an open mind. Suspending judging, which is actually tremendously relieving and relaxing. Having patience. Not striving in everything we do, but actually going at things more gently. Trusting in our instincts and in ourselves. Letting go of the need to be right or to have a specific outcome all the time, but accepting that outcomes can be different to what we are attached to. And that's a very actually relieving thing as well, where our bodies become more relaxed, more open, and less, I would say, velcroed to an outcome that we can't live without, because often we can if we really look at it carefully. And acceptance, not of everything's going to always be this way, but acceptance of the way things are in this moment. Because once we've arrived at acceptance, say that we have difficulty with our blood sugars right now, or we have this degree of pain right now. Once we arrive at the acceptance of that, we actually can spring forward and change things going forward. But if we're never meeting acceptance, then it's very hard to change things going forward. So when we're working with people in pain or people with chronic stress, Our course is divided into 3 parts, where we introduce tools to increase wise mind and resilience, often by practicing meditation in various forms. It can be active meditations, such as walking, mindful movements, yoga, and so on, or sitting meditations. In Module 2, we enhance that mind-body connection awareness, and we also look at self-nurture, eating properly, sleeping appropriately, and introducing sleep hygiene habits, exercising or moving in ways that we may not have entertained before, but adapting to our current levels of illness, disability, whatever we have as a challenge, and moving forward despite it. And enhancing our relationship skills in a broad context within our families, within our work situations. This can be remarkable in terms of creating the enhanced quality of life for ourselves and those that we communicate with, and in reducing the possibilities of developing illnesses and dysfunctions. So the elevator description, this is where you might stand in an elevator and somebody says to you, well, what's this mindfulness stuff that you're talking about, that you're studying at the moment? And maybe the best way is to say that it increases resiliency in stressful and challenging situations by reducing negative judging. And this results in less negative impact on our protective systems in our bodies, which includes our immune systems, and results in lower likelihood of developing dysfunctions, disease, and prolonging injury. And there's faster recovery from the challenging events that we encounter, and we become more productive and more collegial. That enhances everything. So you can have a ripple effect within your organization and within your families. If we look at pain and why meditators actually feel less pain, because there's good studies to show this, we actually, when we encounter a painful stimulus, we are actually not lighting up the cognitive and emotional areas of our brain so much. It sort of stays contained, more in the area of the brain that notices the pain sensation, and it's less about catastrophizing or making the experience worse by dreading or worrying about or thinking about all the things it holds us back from. So those areas don't then engage. And by doing so, interestingly, there's a side effect which we really need, which is that in a certain part of our brain that has a top-down effect on dulling pain on our behalf, that actually is less inhibited by the emotionality, and it can go to work much more vigorously and be more active in preventing the pain from winding up into a worse sensation, a more intense feeling of pain. So the studies are showing that meditators feel less pain. They suffer less. Okay, and the proof of the pudding is that when we do the work we have been doing for years in our chronic pain groups that take mindfulness training from us, we're noticing that there are decreases in pain medication use, that 34% are decreasing or eliminating their pain medication use. Some are not, which is absolutely fine. We don't set out to reduce pain medications, but it's nice if there is some. But even in other health conditions, with same groups who often suffer anxiety and may take medication for anxiety, blood pressure, hypertension, they may be on medication for that, depression and insomnia, we're seeing decreases in the medication usage as they go through our courses. And to work, well, often we've been working with people who are long out of the workforce through their disability, especially in the pain clinics, but we are actually seeing some return to work, full-time and part-time, and even that amount of returning to work is huge and really good news for insurance companies, but also for the people who wish to return to work. Other impacts, we've had feedback by doing the data on this, that 73% feel more productive after doing these courses, can be more engaged with family and friends, and also with hobbies, recreational activities, physical activity, and volunteer activities. And interestingly too, the amygdala, which is the part of the brain that's engaged with emotion, actually shows a decrease in density. So as people graduate from the mindfulness courses, this is not our data, this is data gleaned from mindfulness-based stress reduction courses, the gray matter in that part of the brain decreases, which is what you'd like it to do in an organ which expresses emotion. So the amygdala decreases in its density, meaning it's not being used as much, meaning we're not stressing out as much. So this is a good thing to see. Psoriasis, which is an active skin condition which is made worse by stressful challenges. We all know that psoriatic sufferers have breakouts when they're stressed. When the research study that looked at the influence of meditation on healing in psoriasis showed that those who were meditating when they were receiving light therapy for their psoriasis healed 4 times faster and a lot sooner than those who weren't doing meditation while they were receiving therapy. That's a very, I think, visible evidence of the fact that mindfulness and meditation affects our health conditions. It also increases telomerase activity, which is an enzyme that keeps our chromosomes nice and healthy for us, stops them fraying and deteriorating, and that actually helps us with disease resilience, but also with aging. Mindfulness training also restores diurnal rhythm, that night-day hormone level fluctuation that's also associated with disease resilience and associated with functioning better. So there's evidence for lots of good stuff that's happening to our minds and bodies with training. Chronic low back pain, the studies have shown that mindfulness could even beat painkillers in improving outcomes with people suffering from chronic back pain. You do have to continue to practice this stuff for it to remain helpful. In diabetes, there's sustained effects of mindfulness-based stress reduction in diabetic patients, providing they continue to practice mindfulness. And this showed lower levels of depression and improved psychological well-being for up to 1 year later. For diabetes, improved glycemic control in type 2 diabetes. That was a pilot study. It improved the H1AC levels. It improved anxiety, depression, and psychological distress. That was a small pilot study. And in the workplace, professional organizations are now using mindfulness to support goals such as change readiness, agility, and resilience. And this was actually reported in the media quite recently. But it's not enough to simply offer one-off courses. They do need to go deeper and be more sustained within organization and become part of the business's, it says here DNA, but I would say part of the business's culture, and that's beginning to happen. Aetna, which is a huge insurance company, reported a saving of $2,000 per employee in healthcare costs and gained $3,000 in employee productivity after implementing a mindfulness program 2 years ago. Google is implementing it, General Mills, Target, and Intel. And we've implemented mindfulness-based chronic pain management and chronic stress management in hospitals and community health centers for health staff because they're pretty stressed by the work that they do. We've embedded facilitators in organizations. 100% of those taking the courses would recommend them to others. But it does have to be followed by maintenance programs to continue the gain made. And embedded facilitators need to be present to support their organizations. Also helps really employees with their families. Some of the tools that corporate use, such as Luminous Spark for pain and stress management, you may have seen these being introduced into organizations in the form of predecessors to Luminous Spark. These are personality trait type tools that are used to enhance employees' understanding of each other and each other's strong points and give them respect for each other's strong points, and help them with understanding their own blind spots. And tools like this have included Insights, True Colors, Myers-Briggs, which is probably the most famous. But Lumina Spark is one we've introduced because it's based on traits rather than types, and it shows shifts in characteristics when under stress. So it can allow you to actually see what stays true within you when you're under stress and what you can leverage as a quality that you have when some of your other qualities have distorted because of stressful situations. It increases communication skills, and with mindfulness skills added, it allows faster regaining of composure. It really improves how teams interact with one another. It will improve how families do as well. So some local organizations that have implemented it: Halton and Peel District School Boards, Ryerson University, Yum Foods. This is a form of corporate mindfulness that we have included. And all these organizations, you can see the logos for L'Oreal, for CIBC, for Universal. These organizations have been starting to bring Lumina into their organizations to promote improved, I would say, mindfulness, doing such tools as Lumina. Now, we've actually blended our mindfulness work. We've introduced Lumina to mindfulness alumni of our courses, and they found it amazing, and they found that they said that they wished it had been implemented for them before they got invalided out of the workforce. And the question we had was, did it help pain and reduce suffering? So we looked at data on this, showed that even up to 4 months after finishing a Lumina Spark course, for alumni of our mindfulness courses, that their pain levels had gone down by an average of 2 points on the pain scale. If you had a drug that did that, you'd want shares in that drug. So just introducing the Lumina Spark work to them really enhanced their pain management, and it also actually enhanced productivity. So if Lumina tools are probably more acceptable to staff rather than mindfulness, which for many people still sounds a bit woohoo, and men don't seem to sign up for mindfulness courses anything like as much as women do. Only 20% of people entering our courses are men. We have found that by introducing Lumina programs, they're happy with those, we can bring mindfulness programs within the Lumina program, almost like the Trojan horse, and then they can get the blend of both. So this has been the way that we are working with corporate mindfulness. So that's where I would like to take you for now. The mind-body connection, alive and well and extremely influential in terms of our predisposition to developing diseases, to developing difficulty with challenges in our lives, and yet we can harness the mind-body connection to actually increase resilience if we are aware and mindful and trained in mindfulness or cognitive behavioral procedures, but I'm more well-versed with mindfulness work and prefer it. And we can go forward with populations that are seeded with mindfulness, and they can actually have a ripple effect in corporations, in families, and so on, so that gradually over time the entire population can be seeded with mindfulness. They don't all have to study it, but those who do can actually influence those who haven't chosen to study it. And we can promote a society that is more resilient and more healthful as we go forward in future decades. Thank you for listening, and we're happy to take some questions.
Thank you very much, Dr. Gardner-Nix, for providing us with some very great insight into mindfulness, as well as the importance of having a positive mental health in the context of diabetes. So with that being said, we will take some questions now. So with that, I'd like to start off with our first question. Could you please explain if there is a relationship between exercise and stress management?
There is indeed. There's quite a bit of research to show that exercise is extremely influential in decreasing stress. And there's a very simple reason why that might be, actually, and that is that when we exercise, we increase endorphins in our bloodstream. Endorphins are our internal painkillers, but they make us feel good, like the runner's high. People have heard of the runner's high, usually. We also increase other feel-good hormones, such as serotonin. So when we are regular exercisers, we are utilizing the ability of exercise to produce feel-good hormones in our systems that actually regulate us very well. Endorphins, for example, are good in healing us. So even though endorphins look like narcotics, the external narcotics we might take don't heal us, but our endorphins, that are our internal narcotics, are great promoters of healing. So yeah, exercise is terrific in making sure that stress is busted. We feel usually much better about stressful situations that we're encountering if we are regular exercisers.
Great. Thank you so much for that explanation. Our next question comes from a participant. They're wondering, in terms of the workplace, who would they be able to speak to at their workplace to get the Lumina program implemented?
Generally, you go to your HR, because HR is involved in ensuring that programs are brought into organizations in order to give enhanced education, to enhance wellness, to reduce absenteeism. It's in their best interests to introduce programs such as Mindfulness and Lumina. And there are quite a few corporations now that want to bring in both. Usually we are in discussions with HR, but sometimes it can be wellness and safety. Sometimes they will have a specific coordinator, depending on the size of the organization, that is responsible for bringing in executive education. And generally the executives get educated first, and then when they see the benefits, they want it brought to the managers and then to the general workforce as well. So it's good to stop at the top and sort of rain down onto those who are at all levels of the organization.
Great. Thank you so much for that. And folks, if we do not get to your questions today, we do apologize, but if you can email us at webinars@diabetes.ca, we'll definitely be sure to get back to you as soon as possible. So with that, we'll take our last question here. Are there any resources that you could recommend around mindfulness, or perhaps any apps or online websites that you could recommend?
There are apps out there for mindfulness, but I don't particularly like the idea of doing apps because I think, first off, mindfulness is not a benign intervention. And for people who've had trauma, when they do start to practice formal practice, regular meditation, I think it's important to be in contact with trainers, with people who are taking you through a course, people who are mentoring you, in case things come up which are unwelcome. And yet, when they do come up, and they do cause some difficulty, working through them is incredible for laying those things to rest. Not that you get past them completely, but you know how to handle them. So I think it's important to work with resources which are not just apps. We do have our own book, The Mindfulness Solution to Pain, that was written as a mindfulness guide for pain sufferers, but it's also our course textbook for the courses that we offer. And courses like ours, by the way, are offered throughout the province through telemedicine, through Zoom interventions, so you don't have to geographically be placed in a city to get them. We've also translated some of our stuff into French, and it's being delivered in Quebec, and some is being delivered into the States as well. We have CDs, which are meditations which are trauma-informed and are aimed at pain sufferers, but also at stress sufferers. So people who know that they suffer chronic stress, we have a whole batch of meditations that they can work with. We have workbooks as well. Again, I prefer that the workbooks are worked within a formal course. But again, we have those that we can provide both into corporations, in a clinical setting, and even some of our facilitators that we've trained will work with people one-to-one. So lots of resources that way. And on any in any bookstore, you will find lots of books that are named mindfulness-based this and that. So lots of mindfulness courses aimed at various conditions, by the way, such as addictions, and also pregnancy, childbirth. There's mindfulness, of course, in schools. There's all sorts of applications, so you may want to have a look, go to Amazon.com and have a look at what's available.
Great. Thank you so much for that thorough response. And folks, that does conclude our webinar for today. I'd sincerely like to thank Dr. Gardner-Nix for speaking on behalf of Diabetes Canada, as it's been a very great learning experience. I do want to remind everyone that today's webinar has been recorded and will be made available at our Diabetes Canada website in the coming weeks. Be sure to join us next week, Wednesday, October the 18th, for the last webinar of our complications series. It'll be on taking care of your nervous system. So to find out more information and to view our past webinars, please do not hesitate to visit diabetes.ca/webinars. And for those of you participating in our webinar today, please be sure to tell your family and friends to take the Degenerative test to assess their risk for developing diabetes. Did you know that 1 in 3 Canadians have diabetes or prediabetes and they don't even know it? So test for type 2 diabetes today by visiting diabetestest.ca. We encourage Canadians to take control of their health and to test annually. And for those of you looking for more support and resources for living well with diabetes, please feel free to call our toll-free line at 1-800-BANTING. So that's 1-800-226-8464. We thank you for joining us today, and we hope you've enjoyed learning with Diabetes Canada and look forward to your participation in the future.